The great thing about the Bariatric Metabolic Center of Colorado is we have all of our services under one roof. We have our dietitians, our social workers, the nurse practitioner, the surgeon, all under one roof in the same place. Patients don't have to go all over town to get their various appointments taken care of. They just come in the door and we take care of all of their appointments in one day. It's also very refreshing for patients to be able to have surgery in an environment where the hospital is really dedicated towards this service line. We have special bariatric rooms, we have a bariatric floor. The furniture is designed in our hospital to be sensitive and comfortable for all types of patients, not just bariatric patients. We're also able to provide services where patients don't feel that they're stigmatized for coming here for weight loss surgery. Our hospital, the entire hospital, from the volunteer services to the people in the cafeteria, to the folks up on the floor, to the radiologists, all throughout the hospital have been educated on how to be sensitive and how to appropriately care for bariatric patients. The other really nice thing about our program is there are very few bariatric surgeons in the state of Colorado that have actually undergone formal bariatric fellowship training. I'm one of the only surgeons in the state that has undergone that training. Patients that are trying to decide whether or not to have bariatric surgery, I ask them to really spend some time evaluating their options, not just with me and with our program, but with their families and with themselves. Have they tried various different modalities? Have they tried all the different diets that are out there? Have they really exhausted their possibilities in terms of medical therapy for weight management prior to coming to me? I'm sort of the last line of defense. We don't want people to view surgery as the easy way out. It's not an easy way out. It requires a lot of preoperative visits and testing. It requires maintaining a relationship with me and with my staff for the rest of their lives. It's a very significant undertaking when patients commit to bariatric surgery, and we ask them to really think about all of the treatment options that are out there. Additionally, we ask patients to think about the different medical problems that they've developed and what they're destined to develop if they don't do something about their weight. High blood pressure, diabetes, sleep apnea, heart disease, stroke. So many medical problems are associated with weight. And if people continue to push off getting the appropriate therapy for those medical problems, they're going to have not only a poor quality of life, but they're going to have a significantly shortened quality of life and a shortened life expectancy. We're seeing as much as an 8 to 15 year increase in people's life expectancies after bariatric surgery. And it doesn't just affect the patient, it affects their entire family. We've seen entire families that have had significant improvements in their health just by one family member having bariatric surgery. So we ask patients to really think about the culture in which they're living and their entire families, not just themselves, in terms of making good health choices and getting on the road to recovery. It is so rewarding for me to see patients get their lives back. It's one of my favorite parts about being a bariatric surgeon. It's one of the reasons I went into bariatric surgery. We've got patients that can't do any of the things that normal people should be doing, can't walk down their driveway to get their mail or pick up their children or go to the movies or even get on a roller coaster, just things that we take for granted. And being able to give those abilities back to patients to be able to improve their quality of life is really one of the most exciting parts of being a bariatric surgeon.